Good afternoon. Thank you for joining us today for today's update. I'm here with Health Commissioner Dr. Jaraza and Police Commissioner Harrison. Before we give it to Dr. Jaraza, we want to focus today on a pressing thing facing the city of Baltimore continuously, and that's a violent crime in our city. And I'm going to turn it over to Commissioner Harrison for remarks first. Mr. Commissioner.
Good afternoon, and thank you, Mr. Mayor. Earlier today, our department announced a recent warrant initiative aimed at apprehending individuals wanted for domestic violence and at-risk individuals. A total of 58 arrests were made on warrants to include second-degree murder, domestic violence assault, child abuse, and attempted murder by shooting. Through this initiative, we were able to close 97 open warrants. So far this year, we have seen a 31% increase in violent crimes related to domestic violence. While working with local organizations and our city partners to address this concerning trend, it is not only important that we are getting actual victims and potential victims the resources needed, but that we're also apprehending and holding these suspects accountable who are committing these violent acts. We will continue aggressively to pursue those who wish to cause harm to others. 4 guns were seized during this initiative, and that is no coincidence. Those who are intent on engaging in violent criminal activity not only target acquaintances, but also display those same violent behaviors by victimizing their loved ones. If you are a victim of domestic violence or you know someone who is a victim, there are resources available. You can contact our partner organizations like House of Ruth, Turnaround Inc., or 911, or our Family Crimes Unit at 443-984-7030. I want to thank all of our partners who joined with our department in serving some of these very dangerous warrants. Much of our success with this initiative was due to the partnerships with community organizations and our law enforcement agencies at the local, state, and federal level. Lastly, I'd like to discuss the recent violence that we saw yesterday and this morning in our city. In the last 24 hours, our officers responded to 8 shooting incidents, leaving 4 people killed and 6 people suffering from gunshot wounds. This morning, detectives arrested 29-year-old Philip Blackship for the murder of 39-year-old man in the 1200 block of North Charles Street in the Mount Vernon neighborhood. Our detectives are continuing to comb through evidence and follow leads in every last one of these cases, but we are asking for the public's help. If you have any information that will help us solve any of these cases and locate any of the perpetrators of these cases, please call police right away. Or you can anonymously call Metro Crime Stoppers at 1-866-7-LOCK-UP. Thank you. I'll turn it back over to our mayor.
Thank you, Mr. Commissioner, and thank you to everybody in BPD and all our partners that participated in the warrant initiative. We know how critical the collaboration between agencies is to help bring people that we need to get off of our streets off the streets. So I want to thank all of our partners. Also want to thank the women and men of BPD for the work that they have done, even trying to tackle the recent violence in the city. Having an arrest and a homicide within a few hours of it happening because of the work that our officers did on the ground, the detectives did in follow-up, is a very important thing. But still, having 7 incidents with 8 victims over a small period of time is not acceptable to us. I met with the police commissioner and his team earlier today and just re-emphasize with them the importance of them being proactive, being in the places and interacting with the people that we know are trying to commit harm on the city, and they will continue to do so. That is what keeps me up at night. That's what keeps me burning the commissioner's phone up at night, is to make sure that we are making the progress on the folks that we need to. We are not where we need to be with reducing homicides and shootings in the city of Baltimore right now. I am not happy. This is not the face of someone who's going to accept the numbers that we have today. And while we have seen some progress in other areas, with total violent crime being down 31% and robberies being down 38%, there are too many people getting shots on the streets of Baltimore City, and we have to push harder on that. But that's not just about them. That's also about us as a community and as a city. That's about us as other agencies in city government. We all have to be better. People should not get shot over stupid beefs. People should not die over small, simple things that we can resolve our conflicts in a different way. We're going to continue to press to get guns off the streets of Baltimore, to get people who are violent off the streets of Baltimore, but we also have to work to build better communities in our city. That pain and loss of life that we've seen. And I want to just offer my condolences to all the victims and families of people that we've lost in Baltimore this week and this year. Again, know that my heart goes out to each and every one of you, and I'm going to continue to press for us to be better and how we're helping to prevent and solve these crimes of violence in our city. I want to now turn to COVID-19. I want to remind everyone that our latest executive order went into effect today at 6 a.m. We know we have decreased the assessment period for us from every 4 weeks to 2 weeks, so we'll be making another assessment next week. Gatherings must comply with any relevant capacity base in the space which they are located. Indoor facilities are limited to 50%. Outdoor recreational establishments at 50%, and outdoor dining is at 75%. You can see the breakdown of that executive order at coronavirus.baltimorecity.gov, and I will now turn it over to Dr. Jaraza for further comment.
Good afternoon, and thank you, Mayor Scott, for your leadership and continued support of public health during these challenging times. I'd like to briefly share the data on key COVID-19 metrics in Baltimore City. As of yesterday, we have lost 839 lives to COVID-19. We have had a total of 43,331 cases in Baltimore City, and our latest 7-day average new case count is 143 cases per day. This is a 100% increase from 4 weeks ago. Our latest 7-day average positivity is 3.3%, an increase of 88% from 4 weeks ago. Our hospital utilization rates have remained consistent, with ICUs up slightly at 89% and acute care units down slightly at 86% capacity. Fatalities due to COVID-19 are now averaging approximately 2 deaths per day. While our data still shows some cause for concern and high amounts of community transmission, we are beginning to pass important benchmarks towards our goal of seeing 80% of Baltimore City residents vaccinated. This week, we crossed an important milestone of 22% of all city residents generally and 43% of residents 60 and older receiving at least 1 dose of a COVID-19 vaccine. At this time, 12% of Baltimore City residents are fully vaccinated, and we are on track to meeting and possibly exceeding our goal of having 20% of city residents fully vaccinated by the end of April. This week, we have made incredible strides in our mobile vaccination units. Alongside our clinical partners, we have held 46 vaccination clinics to date and have vaccinated approximately 3,800 older adults and persons experiencing homelessness. We remain grateful to Johns Hopkins Medicine, MedStar Health, LifeBridge Health, Safeway, and Northern Pharmacy for their collaboration and support with our mobile vaccination units. Today, I'm pleased to also announce that beginning next week, Rite Aid, Ascension St. Agnes, and the University of Maryland Medical System will also begin mobile vaccine operations, further increasing our city's ability to reach older adults and other populations who may have difficulty reaching mass vaccination sites. Next week, the Baltimore City Health Department will be holding first-dose mobile vaccination clinics for older adults at the following locations: the Lillian Jones Apartments, Landvale Towers, Bell Park Towers, Greens at Irvington Mews, and Wyman House Apartments. We'll also be returning to the following locations: Christ Church Harbor Apartment, Linden Park Apartments, and Bernard E. Mason Apartments for second-dose clinics. In addition to our older adult outreach, Baltimore City Health Department teams and our partners will be vaccinating persons experiencing homelessness at Helping Up Mission, Green Spring Station, Turk House, and Baltimore Station No. 2. With the Maryland Department of Health's announcement that by April 27th, all Marylanders will be eligible to receive the vaccine, all Marylanders over 16 that is, we've created a vaccination interest form for all city residents 16 and above on our website. We encourage every city resident with access to the internet to begin pre-registering for the vaccine now, and we will be announcing plans for those without access to the internet to register in the weeks to come. I'd like to be very clear. This list is not necessarily first come, first serve. We continue to have a focus on equity and vaccination of higher-risk individuals first with the limited supply of vaccine that we have. We continue to follow Maryland Department of Health's vaccine prioritization guidelines for local health departments. Once vaccine availability increases and eligibility expands, we will contact those who have filled out this form and provide them with details regarding how they can schedule a vaccination appointment. This latest general information form joins 2 others we've set up specifically for older adults age 60 and above, who as of this week are now eligible to receive a vaccine, and those residents with intellectual or developmental disabilities, all of which are accessible at bit.ly/BeMoreCovaxInterest. We are asking that older adults, those who have intellectual or developmental disabilities, or their caregivers, please fill out those interest forms, which include a question about whether or not that individual is homebound. This information will inform our outreach efforts over the weeks to come. Those individuals can also call the Maryland Access Point at 410-396-2273 if they don't have internet access, and a representative will help them fill out the form. During the pandemic, the health department has been tracking mobility data of city residents as a means of estimating social distancing utilizing geolocation reports from mobile devices. This mobility index information can be found on our dashboard and shows that over the last several weeks, since late February, we're seeing more residents travel at levels we haven't seen since before last summer's Independence Day COVID-19 case spikes. As we head into another holiday season, I'd like to take the opportunity to remind residents that while we are all anxious to see loved ones, the CDC guidance is clear. Only fully vaccinated individuals can gather indoors with other fully vaccinated people without wearing a mask. You are fully vaccinated if it's been 2 weeks since the initial single dose of a Johnson & Johnson vaccine or 2 weeks post your second doses of the Moderna and Pfizer vaccines. Additionally, if you are vaccinated, the CDC says it's okay to gather indoors with unvaccinated people from one other household without masks unless any of those people or anyone they live with has an increased risk of developing severe COVID-19 illness. So unless you've been fully vaccinated, you should not be celebrating holidays in person with those outside of your immediate household. While vaccination rates are increasing daily, the majority of residents still have not yet been vaccinated. Yet our mobility data suggests that many residents are moving about as if they have been. We need all of our residents to continue practicing the same common sense behaviors that help protect against COVID-19 transmission and help save lives. Wear a mask, practice social distancing, avoid large gatherings, wash your hands, stay home if you're not feeling well. By all means, get tested if you are having symptoms of COVID-19 or if you've been exposed to someone with COVID-19 or with symptoms of COVID-19. If you've seen me at the podium speaking at any point during this year, you've heard me repeat these phrases often. While we continue to push to vaccinate as many people as possible, these behaviors are so critical for preventing another surge in cases of hospitalizations and of deaths. As Mayor Scott said, we now see the light at the end of this long journey, but we haven't reached it yet. This period may be the most challenging we've been in so far, with more than a year of mask wearing, of social distancing, and of not seeing our loved ones. But we're not in the clear yet, and it would be foolish to throw away all of our progress when we're so close to ending the pandemic. Please do your part. Wear a mask when outdoors, practice social distancing, avoid large gatherings, and get the vaccine when you're eligible to do so. Thank you.
Thank you, Dr. Jaraza. As you heard, now is not the time to act irresponsibly. That light is coming, but we have to walk cautiously towards that light of the end of the tunnel. I urge everyone to continue to do their part and follow the best practices. Wear your mask, social and physical distance from around folks when you're in public. Wash your hands frequently. Don't intermingle with other folks from other households unless you're following the CDC guidance. All of these things are important, even this long into this pandemic, because if we want to make it out of the other side in the quickest rate possible, those small steps, especially as we go into another holiday season, will be critical for us to make sure that we continue to make it towards the end of this pandemic. And at this time, we'll take a few questions. And I can hear you guys today, so. First, Alexa? Oh, hold 1 second, Alexa. Let me try that again. I can hear you, but they're recording it. There you go.
Check, check. Oh, perfect, okay. I had a question for the commissioner, if that's all right, regarding the recent violence in the past 24 hours. What immediate action is being taken regarding that?
Mr. Commissioner?
Well, certainly deployment strategies always get adjusted. We monitor what happens in our city every day, really multiple times a day, but we had a good deployment strategy in place, and we just had to make adjustments based on where the majority of the violence occurred. Certainly there are investigations that are on the way that we certainly need help identifying people who are responsible for that, but we made adjustments in our deployment, making sure people are available for those deployments and are doing what they're supposed to be doing. We know that that happened in one of the cases because the officers were there to witness at least one of those, and then we made an arrest on one of them. But it's always about monitoring, measuring, and ensuring supervisors are supervising officers who are performing.
Thank you. And then my second question regarding the investigation with Savannah Payne, the remains that were discovered just yesterday in the harbor. Some neighbors had expressed that they called 911 and it took more than an hour for police to respond. Is that a concern you heard as well as Commissioner? Any response to that?
I had not personally heard that, but when we get complaints like that, those are always concerning. And those are complaints we take seriously, and then we look into it to find out why. And then we make adjustments to ensure that that doesn't happen, especially when there are calls of an emergency nature.
Thank you.
Thank you.
Alexa, before you leave, on that in particular, in this case, that is not the case. We did look into it with the police department, and they responded out in a proper manner. And in the future, we know, unfortunately, this is a tragic incident with this young lady. I'm sure in the future, the police commissioner and folks will be able to share more information.
Okay, thank you.
Thank you. Anybody? Come on, ma'am. How are you? I'm not used to seeing you at these. I see you on TV, Kate, but not in person.
Well, I'm going to ask you a lot of coronavirus questions.
Yes.
But actually, with the state moving into 2B on Tuesday, it might be a good time to look at all of the different you have a whole lot of different clinics and mobile clinics, which are, we know are really important for a lot of populations. Can you give us an idea of across all the clinics the city's running or the clinics going on for city residents, how many doses an hour you're doing? I know that's really a mass vaccination question, but you might be able to answer that. And I'm wondering the 80% goal, will that change with, when was that set? What's the end date of that? And does Johnson & Johnson change, when will you increase the goal to more than 80%?
Yep, I'll let Dr. Jiraza answer, and I'll come behind him. Dr. D.
Yeah, the doses per hour, like you said, that's a throughput, and that's typically, we think about it with mass vaccination sites. And so I kind of think of them in a couple buckets, right? So there's your mass vaccination site where you might have a throughput of 150 per hour. But then there's also our mobile vaccination clinics, and those are very different. That's a clinical team, a small clinical team with community health workers going to a senior housing site. And so we've pre-registered individuals ahead of our visit there, so we know how many we're going to do that day. And it's been variable. It might be anywhere from 75 to 150 residents on a given day. So it really just depends on that particular senior or mobile housing site. Same thing with our clinic supporting residents experiencing homelessness. We've typically done some sort of pre-registration, so we get a sense of how many we'll just do for that particular clinic. So then your other question was around the 80% goal of vaccination. So we announced that back in January as a part of our overall strategy. And that really comes from CDC guidance that we need at least 60 to 80% of the population vaccinated to reach herd immunity. So we were looking at that happening by early next year, right? So we recognize that, one, we've got to get the vaccine administered. We also recognize that there are a lot of people who are vaccine deliberating, and we recognize that the vaccine's not available to people who are under 16. So all of those things went into the decision on why we said 80%. and while we'll say at the beginning of next year, because it's not yet approved for children, which make up about 20% of the population. Right. Yep. 2022. Yeah. Yep.
And just to add to that too, I think as I visited one of our mobile sites this week in Cherry Hill, we've had a lot of conversations about inequity, just noting that 80% of our mobile vaccinations have gone to African American and seniors in places. And just visiting with the folks in Cherry Hill, Kate, on Monday about this, they were very happy, thinking about the transportation challenges we have in neighborhoods, like thinking about how folks in Cherry Hill, it would be hard for them to get to other places, even though they live with a light rail stop. They have to walk. You know, those seniors would have to walk a big bit of distance to get to that light rail stop, to get up to the convention center or the stadium. So having it go to them is critical, and I know that we're grateful for our partners with the health department, MedStar, Hopkins, all the folks who are helping us with our mobile clinics. 80%. Mobile clinics, African Americans, yes, ma'am. Alexa, I'm about to say, go
I
ahead.
asked them if they had.
All right, they were in line. That's
I
all.
did.
You go ahead.
The last question I had, as you, for the commissioner and the mayor, both aware, city state's attorney made the announcement not to prosecute low-level crimes, including some drug-related crimes. Do you feel this will impact violence in the city?
Well, I think what I'll say, Alexa, is that we know that we have to change the way we deal with approaching especially low-level crimes, right? We have the data. Zero tolerance, arresting folks for minor drug offenses did not make Baltimore a safer city. In fact, if you look at it, where we are today, we can say that the outcome of that was the opposite in many, many cases. What we're going to do is continue to progress on how we can be focused on the most violent criminals. We have to reimagine what public safety it is in our city, especially in a city where we have dealt with. When you think about, Alexa, you and I have spent a lot of time over the years talking about gun violence and the amount of people we lose to gun violence. Well, the thing that we don't talk about is that we lose more to that than overdose. And we've been treating in this city, in this country, people who have addiction problems like criminals, and they're not. We have to change that mentality and get them the help that they need. And if any city in America can do it, it's the city that has the world-class health institutions that we do. And I'll let the commissioner comment any further.
So, Alexa, I'd agree with the mayor that we are perfectly aligned with the mayor's office and the police department that we're focused on violent crime. And to the extent that not prosecuting minor offenses at the beginning of COVID, leading up to now and then going forward in the future, there is data to support that crime was reduced, but we still have the COVID factor, and we still have to continue that going forward. We want to be focused on violent crime, and we want to make sure people who are caught up and need help actually get the services they need, not necessarily police enforcement.
Sure.
Mr. Mayor, we were hoping to get your reaction to the Mosby investigation.
No, thank you. We know, as I said in my State of the City last week, that restoring trust in city government is a top priority for me. I'm aware of the investigation. These investigations will take its place. They have a start course, they have an end course. But I will not be distracted from what the citizens of Baltimore have tasked me to do. And that's where my focus remains. We will not continuously comment on an open investigation. I am focused on the things that we have to do in city government. That's build public safety in Baltimore. Get us through this COVID-19 pandemic and the recovery. Build a better city government that people can respect and understand and believe in. That's what my focus is. Yes, sir.
Hi. Just recently, German Chancellor Angela Merkel talked about the COVID variant B117, I think it is, and there's also a P1 variant. Yet during this press conference, I've not heard any of you talk about the variants at all and its potential risk of blowing up in the United States and in Maryland. Do you all have any response to that as far as what you all, is it on your radar or whatever?
Dr. D?
And we have talked about the variant in past press conferences. I will say, obviously, we know the variants sometimes have increased transmissibility. We know that the vaccines may be slightly less efficacious against some of the variants, but I think it's all the more critical for that reason that we put into place everything we put into place. So everything that has kept us safe from the original, SARS-CoV-2 prior to all of the variants that we knew about will continue to keep us safe. So we have to keep doing those things. We have to get vaccinated when you are eligible to do so. Please get vaccinated. We've talked about the sites that the City Health Department is supporting, our mobile sites, but we also have the Convention Center that's vaccinating and has a priority for city residents. We have M&T Bank Stadium that has also set aside vaccination slots for city residents. So I think it really just underscores the importance of getting vaccinated when you're able to do so.
I
Last
can
question.
follow up
Kate?
on that, 'cause a two-part question. First part for you. You mentioned increasing case rates and 100% increase in your daily case rates. What does the data tell you is driving that? And Mayor Scott, why loosen restrictions if the metrics are going in the wrong direction?
Yeah, so we talked a little bit about mobility data, and that can actually be found on our website. So coronavirus.baltimorecity.gov. If you go through our dashboard, there is a portion that goes over mobility data. And we saw around the third or fourth week in February that there was an increase in mobility. As I mentioned, that was comparable to what we saw last summer. So we know that people are just generally more active and are maybe returning to behaviors as if it was pre-pandemic. So that could certainly be contributing to what we're seeing. We also know that generally speaking, what we've seen is that that young people, those again under 60, tend to have higher case rates. So again, maybe there's a bit more risky behavior. So again, it underscores how important it is to keep doing all of the things that have kept us safe so far.
And Kate, what I would just say is that I think we all know by now that we have a time frame which we analyze the data, which Dr. Zaraza, myself, and my advisors will do. And if that data, as we get to our next point, says that we need to put more stringent restrictions on, I will not hesitate in doing that. But we set a time out there, we analyze that data, and if we know it's going to continuously move, we're not just going to react one way or another after a 1 day or 2 day thing. We're going to continue to do it in a more responsible, data analytical kind of way. Thank you, everybody.